of England, Scotland, Wales. And what you can see is that there, in terms of the number of people in hospital, there has been a peak in London. It was probably around the 10th of April, that kind of date, and since then there has been a decline. But in the other parts of the graph, that is to say Scotland, Wales and the other regions in England, I suggest to you that there is rather more of a plateau than anything else at this point in time. It is not absolutely clear that there have been peaks, nor is it absolutely clear that the rate is, that the number of cases is dropping in the same way that we can illustrate it on the slide for London. So again, this is important. It shows the regional variations in how the virus has been affecting the UK. It shows that we are not out of danger at this point and that the curve is flat but not very clearly going down in many parts of the country. I'm sure it will go down in the days and weeks that follow, but we must keep pushing on this and we must bend that curve through our actions. Next slide, please. Now here you see a slide that arrays data by week from the 20th of March through to the 10th of April. And it shows you, first of all, deaths in hospital from COVID-19. Those are the blue columns on the graph. And those are by date of report in the hospital. And the orange bars show the all-weekly registered deaths registered to the Office for National Statistics, and those are by date of registration. And please be very careful in comparing these statistics, because, as you will know, unfortunately, if you've lost someone, it takes a while for a death certificate to be issued and for that to be registered with the Office for National Statistics. So there is inevitably some difference between those two bars, and we are not comparing apples with apples. We're comparing apples with pears on this particular slide. But it does, I hope, help you understand the trends in the mortality data, and we need to see that turn. We'll have to wait a little longer, but we need to see that turn. Thank you. Finally, I will show you a slide I've shown you before about global death comparison.